Very much. My name is Dr. Awolowo Ajaka. I'm the Honorable Commissioner for Health in Ondo State, at least in the last almost 2 years.
Interesting.
22 years.
Tell us the tips.
Thank you very much. Let me emphasize what you just said. Health is wealth. Health also is considered to be a fundamental human right now. Most importantly, is a right. So that one is also very important. Yes, the Ministry of Health is the coordinating ministry that coordinates all the health sector in Ondo State. Let me simplify it by telling you that the health sector comprises of the primary, the secondary, and the tertiary. And in all of this, we have agencies, under the Ministry of Health. We have first and foremost the state primary healthcare development agency that's being created by law. We have Hospitals Management Board, also created by law. We have other agencies like Ondo State Contributory Health Commission. We also have the newly established Ondo State Drug and Health Commodity Management Agency. We also still have ODEMSA, as the emergency agency. That's the emergency agency for the health sector. Then of course, the tertiary hospital has the University Teaching Hospital.
Unimed?
Unimed TH.
Okay.
Unimed Teaching Hospital. Unimed is an institution, is a university, but the teaching hospital is under the Ministry of Health. We also have the Alternative Medicine Board. Has got to do with the traditional medicine practitioners, the leaves, roots, and bags. The alternative. What we say alternative is not orthodox. So that people also believe in. So you
Tradomedical?
Tradomedical, if you like to say, but it is tagged alternative medicine practice. So we have that one. We also have institutions, either vertically or laterally. We have the College of Health Tech. We are doing a program now, nursing program, community nursing program, in collaboration with the Unimed University. We also have the university, who we have lateral relationship with, because it's a mono university. It's got to do with health. It's health and health alone. So we have relationship and collaboration laterally. So this, if you look at all of these things, the health sector in the state is very, very broad. It's wide. So it's a very Herculean task to be able to coordinate all of this. And as the commissioner, I'll coordinate all of this, the activities in all these agencies of government.
Okay. Is there any area this ministry has been able to build a synergy with the federal sector, especially Federal Ministry of Health, and also in extension, international bodies that will bring any.
Thank you for that question. Yes, government cannot do it alone.
Oh, sure.
That's why we have partners here and there. We have collaborators. We have so many people. So vertically, we relate with the Ministry of Health. There's the national policy that we key into. We can adapt it to our own situation. Every state has its own peculiarity, but there's the national policy, the general policy. We will now adapt it to our own state. So there's that one from time to time in all areas of health sector. We'll adapt, we'll collaborate with the Federal Ministry of Health and its agencies like the National Primary Healthcare Development Agency, the NCDC, all programs and projects we do together, from federal to subnational to the local government too, because it doesn't stop with us here. It goes down to the local government and the world. That's one area. Then we'll have partners. There are a lot of partners, and that we work together. The WHO, that's World Health Organization, the UNICEF, the United Nations Population Fund, other partners like Child, yes, Child, Maristo, APEN, lots of them, so many. UNICEF I mentioned, many of them were working together, Then we also work together with funders like World Bank, is always supporting nationally, then to the subnational. So is a collaboration and coordination. So we're doing all of these things together.
All right.
Thank you. The primary healthcare service, before now, there was nothing like primary healthcare. At least it was at the barest minimum. But now we are prioritizing the primary health. Every ward should have a standard primary healthcare facility. Every of the 203 wards in Ondo State should have one where people in the rural area can. But we have 604 primary healthcare facilities in Ondo State. And now we are developing them. We recently will have a program with the World Bank, that's trying to develop all our primary healthcare in the state. We'll take them to the height that if you get there, you won't say you are going to anywhere to access service. In the time past, if you get to some of the primary healthcare, you cannot even say you want to access service there. But this time around, there's the standard that we want to get to. So we are targeting that. And don't forget that, for all of these things, if you build and paint and teach everything, equipment and everything, and you don't have human resource, you are nowhere. So the human resource for health is very important. Recently, the ESCO approved and the governor approved that we should recruit massively for the health sector, and the process is on. We will soon, in the coming days, we will see health workers in all our facilities across the state. This is very huge.
All right. Is there any mechanism put in place to reduce, if not to stop, this Japa syndrome that is flagging around the nation? Ondo State is not excluded.
Well, it's not it's not in my hand. Japa, there's nothing you can do to stop somebody that wants to Japa now. You cannot, even if it's your child, or you can't stop it. But the advantage we have is that we are producing. We have the University of Medical Sciences that's producing doctor. We are producing. We've started producing. We produced last year. We are producing now, and other institutions like I mentioned to you, will have the College of Health Tech. We are producing, at the middle level health workers. We have the School of Nursing, and midwifery. We are doing community nursing and midwifery. So we don't have problem. We don't have problem. What we have now is just something that is not going to last for a long time. Don't forget, these people that are going, to UK, to US, is because they don't have enough. That's why, people are going. Because they don't even have capacity to produce like we do in Nigeria because of the cost. So it's not something, but we are producing. That's the thing.
All right. On a lighter note and conclusively, Honorable Banji Ajaka, if I'm to describe you, how will you describe yourself?
It's you that will describe me now. I don't see myself, but I know we are doing very well in the health sector in Ondo State. Doing very well. In the coming days, you will see what will happen in this state. God help us.
Thank you very much.